Good morning, everyone. Thanks for joining our webinar. I'm so excited to see everyone here in the audience, and we are excited to share some information with you about our latest version of Alex. And we look forward to your questions as well. Right now, I think everyone has their video turned off. Your mics are probably muted. So if you have questions at any point, during the webinar, we're happy to make sure we get all of your questions answered as best we can, but you're welcome to type those questions in the chat feature, and we'll have someone monitoring the chat. And from time to time, we'll stop the discussion, answer questions, and make sure that you have all of the information you need so you can go forth and sell, sell, sell. So get started talking about Alex, the next gen AI. So here's our agenda for today. We're going to do some welcome and introductions, but most importantly, we're going to talk about the big changes between this Alex Gen AI as opposed to its preceding version, which is just the Alex that did not have AI. And then we're going to provide you with an overall head-to-toe demo of Alex. And then obviously we'll give you some time again to finish up, ask questions, and we'll get started. So my name is Shay Steele, and I'm the Southeast Region Sales Director. I've been with Nasco now for a little while, but I think why I'm doing this webinar is I have over 25 years of patient care experience, and I've also got a lot of time doing simulations in the EMS, nursing, and acute care setting. So I've used all kinds of mannequins. But lately, Alex has become my little travel buddy. So looking forward to telling you all about Alex AI today. Okay, so before we get started, let's again make sure our videos are off, make sure our microphones are muted. But here's a little pulse check for you. What best describes your experience with Alex? And Aaron, how do you want them to respond to this?
Yeah, so our attendees can go ahead and answer the poll. We'll give you about 30 seconds or so to do that. There's just three quick questions here, and that's going to help us gauge what we should focus in on and what we maybe will move more quickly along. And then once we've sort of wrapped that up, I'll close the poll, we'll share the results, and we'll let Shay do her thing.
Excellent. And for everybody watching today, it's okay if you've never been exposed to Alex before. After all, that's why we're here. So answer these to the best of your knowledge, and we'll fill in the blanks for you so that you can be successful in the sales environment. And so, Aaron, you can just let me know when time is up and the attendees have answered their questions.
Perfect. We're still just getting a couple more responses here. As soon as I see those taper off, I'll close the poll, probably give another 10 seconds here. We've got 8 responses so far, which is great.
Yeah, I look forward to seeing the responses.
Okay, so we've got some folks who have sold Alex, seen a demo, heard of it, never used it. What they're excited about is the realistic communication, flexibility and ease of use, integration, and then yeah, just
That's good.
confidence. Yeah, we're somewhere in the middle on confidence, so I think this is very timely.
That's great. So this will allow us to um, reminisce a little bit about the former Alex, and then most importantly, tell you what is new and different about the Alex AI so you can point out those sales features to your customers. So next slide, Aaron. So, okay, let's talk about the difference between, so here are our objectives, thanks. We're going to talk about what makes AI different from the previous versions. And here's a little bit about the legacy of Alex, because a lot of people have heard of Alex, but they don't know exactly where he came from and how it has evolved to today. So, about 7 years ago, a little over 7 years ago, Nasco Healthcare debuted Alex in conjunction with PCS. That's the software company. And the whole goal of Alex is to really create a holistic experience for simulation. So in 2017, Alex debuted. He had a little AI network called neural network classification. At this time, the technology was considered state of the art. And wow, how far we've come into 2025. But this has, in 2017, the preceding version of Alex proved effective, and lots of people were starting to adopt the concept of using AI in their classrooms and in simulation. But the important thing is, Alex was starting to generate and collect powerful data that we're going to use to advance the technology. So, in 2017, moving forward a couple of years, we did notice some limitations. The patient responses were consistent as in a real patient, but we did notice some deficiencies. It lacked that true realism that we all long for when talking to patients. The other thing is that the scenario creation was a little time intensive, labor intensive for the instructors, which was a huge downside at that time. So fast forward to 2025. In January, we released Alex AI. So he is truly artificially intelligence powered. The benefits to the AI Alex is that he's always going to adapt in real time to the interactions he has with both the learners, whether that's students, licensed providers, and instructors. He is generative AI driven in his method of communication, and this is going to enable you to have lifelike patient interactions. In other words, you'll be able to talk to Alex just like you would a real human being, and Alex is going to give you real time, realistic responses just like a real patient would. And so the new version of Alex is designed to provide both a technical and so you can do skills with this, Alex. So when your customers are asking what kind of skills can you do with this, Alex, I'll highlight some of those during the demonstration. But then it's also going to help students develop those soft skills or affective domain. So how do you talk to patients? How do you deal with team members as you're working with patients? But a huge benefit too is the customizable scenarios. You'll be able to customize and change scenarios in real time as the scenario is happening. And this is a huge benefit because you can tailor it to specific educational goals, certain aspects of curriculum, and then whatever your training objectives happen to be at that day or even at that moment. So, huge benefit there. That's a big selling feature. All right, so here we go. Let's talk about communication. One of the things I want to point out, you'll see the flags of the countries there on your screen. What is nice about Alex is that whoever's operating Alex can select from many different languages. And this is going to include AI enabled functions for speech recognition. It's going to be, the latency is really good, so it's faster than previous generations of Alex. And having the different languages available, I was in visiting a customer not too long ago. They were speaking to Alex in both Japanese and Spanish, and Alex was answering in English. So it was really nice to showcase the adaptability of Alex to whoever the members of the group that may need additional languages. So I really like this. This is a huge selling feature. Okay, some other assessment tools that are available with Alex. And if you're taking notes, and this is a great time to mention, we will also share these slides with everyone that is in attendance today. So if I'm talking a little fast or you're having trouble writing down, don't worry, we'll send this out to you as well. But there are some assessment tools built in. This is a question that a lot of your end users may ask. So the assessment tools will enable, I saw a thumbs up, that's awesome. So yeah, the instructors always ask about assessment tools, and the important things to note is this will give you both quantitative and qualitative assessments for the practitioners or learners that are going through the simulation. And here's an example there on your screen. You can pick and choose the content that you want to assess your students or your end users can use. For example, they got 100% on greeting and introducing themselves to the patient, which is huge. But oh, let's see. Tracheostomy suctioning. This is a great way for me to notice that that particular student needs some additional help and practice on trach suctioning. So you can see that their overall score is 89, while not maybe not passing in a lot of programs, but it does give us the points quickly and easily that can show those end users where their students need additional training, remediation, or just additional practice. So the assessment feature is a huge selling point.
Shay, we do have a question in the chat.
Sure.
Someone
Excellent.
wants to understand if the language updates are only for the new Alex Gen AI or if those are for the old Alex as well.
And I think we have Michelle with PCS with us. That might be a great question for her to chip in and answer.
Okay, awesome. Sounds good. We'll get back to you guys on that one.
Okay, thank you. But we will have an answer for you shortly. All right, scenario creation. And I'll share my screen and show you how easy this is to do in a moment. So we mentioned that the first generation of Alex creating the individual scenarios or editing the individual scenarios was a little tedious and it took some time. One of the updates with the AI is that you'll be able to quickly edit the root scenario and make changes to an ongoing scenario at that moment in real time. So this is a wonderful selling feature, especially to some of the end users who may have seen the older versions at trade shows or conferences. I would strongly encourage highlighting this that they can easily edit and make changes to an ongoing scenario. So beyond communication, and I'm going to demonstrate some of this, but here are some important features. And I don't know if you're looking at my video, if you can see, I've got my hand, but his chest is rising and falling every time he takes a breath. The movement is very natural, consistent with a real patient. But here's some other features that are important, and you may get questions from your end users about this. Yes, you can intubate Alex. You can use an endotracheal tube or other airway management devices. So, specifically, end users may ask about LMAs or eye gels or any other type of breathing tube. So, you'll be able to insert those into Alex using laryngoscopes or what they call blind insertion device, where you just kind of stick them in. You can also use airway adjuncts. Whoops. I'll talk about that in just a minute. So, circulation, you have carotid, brachial, radial pulse points, and you also have pulses in the top of the foot, which is important. A lot of end users are surprised that we offer that, and they're also relieved at how realistic it is. You will also be able to do chest compressions, on Alex, and then the software also provides you real-time CPR feedback. So it will give you coaching about your rate and depth of CPR, plus it logs that CPR has been started. You can also simulate defibrillation, so no real live electricity with Alex because he's got a lot of electronics already on the inside, but you can certainly simulate defibrillating a patient using the software. And a lot of programs love that simulated defibrillation because it's not actually using live electricity. You can imagine there may be some safety issues with that. So you can also perform urinary bladder catheterization with Alex. And this is a great time to mention we do have accessories available with Alex AI. There are some external genitalia for both males and females, and we do offer a female kit that your users can purchase as well, that has breast tissue and female external genitalia. So this way, he's even more versatile. You can also measure blood pressure. Alex has his little blood pressure cuff on his arm. And the students will also be able to hear those blood pressures. So you can use Alex as a blood pressure trainer as well. And that's using this little smart stethoscope. Many of you have seen these before with preceding. This is the little smart stethoscope. And then whoever's using it can just slide a real stethoscope in here, like so. And they'll be able to, put it in their ears, let's say, and listen to heart sounds, breath sounds. They can listen to heart sounds. There are the heart tones. And then they'll also be able to, down here, let me shift my camera. They can listen to bowel sounds as well. So that's a huge selling feature. One of the other important features is, just like in the photo here, you'll notice we can lean Alex forward and listen to the breath sounds on his back as well. So you can think about, all the times you go to the doctor and how they listen to your lungs, both front and back. You'll be able to do that with these Alexes as well. This Alex AI does come in different skin tones. So we have a light and a medium. Another feature that we sell as an accessory, which I strongly encourage your end users to purchase, is an IV arm that just attaches like one of the regular arms does. And why is that important? So it's not just for IV insertion, but it also can be used to practice blood draws. So if you have end users that are teaching patient care technician or phlebotomy classes, they can also utilize Alex in any of those allied health profession programs. And I did mention the optional female accessory kit that we have. I always encourage my end users and distributors to, kind of let your folks know that that is available.
Hi, Shay.
Do
We
we
actually
have any more
have a question.
questions?
Yeah, perfect timing. We do have a question about catheterization, if it's just
Okay.
male or if it's for female as well.
It is for male and female. If you have remember I mentioned the optional female accessory kit that does come with female external genitalia. So that way the students can practice both male and female. Okay, great. So here's some key features and some of the functions. So this is really what's going to separate Alex AI. First of all, you have the real-time conversations that use the generative AI. So Alex is going to understand, respond, and adapt to whatever questions you ask. And this is a new feature. So there's never really a time that Alex doesn't have some sort of an answer for you. And the important thing is with the generative AI, Alex, you'll notice The time he takes to kind of process your question and then respond to you is much faster. And then you can customize the training scenarios, and you can do that quickly and easily as the scenario is happening. That is a big feature that people love. That way it doesn't change the root scenario, so they can just make changes in response to what the student or care provider does or doesn't do in that moment. And then again, there's artificially intelligent driven assessment. So you're going to get feedback on your clinical reasoning, clinical judgment, and communication. And then furthermore, works with existing simulation training environments. So Alex is portable, he's easy to move around, so you can place him in any training environment that you already have, whether it's, a big sim center or if it's just you in your classroom and you have a wheelchair, maybe a gurney or a bed, or you can put him on the floor. So for our EMS folks, you can put Alex in the ambulance simulators. They can put him on the cots and treat him in the back of their ambulance environments just like they would any other mannequin. So again, way more versatile than some of the older options they may already own. And lastly, but certainly not least, you can create multiple patient profiles, so you're not just stuck with one Alex voice that sounds the same every single time. He will speak to you in different voices, ages, genders, and you can make the cases, the scenarios, either as complex or as simple as you need them to. And so this is important. This is not, Alex is not geared for just one group of providers. You can literally use Alex with any group of healthcare providers, whether that is a true beginner, and this is day one of class, it all the way through, our most advanced ER docs, PAs, nursing, you name it. And that includes respiratory therapy, dietitians, um, like I said, CRNAs, LPNs, whatever group, and that's paramedics too. We don't want to forget our EMS folks. Erin, do we have any more questions? I saw a thumbs up and
Yeah, just one quick question, and I can
sure.
actually answer this one. It's if it's possible to upgrade the previous version of Alex to the new Gen AI. And yes, absolutely, there is a path for upgrade. If you want to reach out to your sales director that you work with, they can help you with the process of upgrading an existing Alex.
That's great. And it's, a great way to extend the life of utilizing Alex in your classroom without actually having to purchase a whole new mannequin. So again, added versatility, value add. Everybody likes that. And now they don't have to worry about storage space for two separate ones. But we'll happily help you sell a brand new one too. Okay, so let's talk about Alex, and I'll walk you through some of the features. So here's my little buddy here, and I just kind of like to go from nose to toes, so to speak, if you will. There is a, oop, see how sensitive he is. I'll get to that beep in a minute. But up here, he has a camera system in the eyes that will record video. And again, depending on which model, whether it's the Lite, the Plus, or the Pro, that depends on how many hours of video you can record. Pro is unlimited. Moving down the face, again, we talked about you can simulate putting oxygen on him using any kind of device. He can be intubated. Students can practice oral care because you can clean Alex with just gentle soap and water. And so, if they have the little swabs to practice cleaning, they can do that. So, hi, Alex, how are you?
I'm not feeling too good. I've been having some serious chest pain.
I'm sorry to hear that. When did your chest pain start?
It started last night.
What were you doing when your chest pain started?
I was watching TV when the chest pain started suddenly.
Oh, I'm sorry to hear that.
Thank you.
What were you watching on TV?
I was watching a documentary about whales.
So you like whales?
Yes, I do.
What is your favorite species of whale?
Humpback whales.
Why do you like humpback whales?
They are so majestic and have such beautiful songs.
Where do you like to watch whales?
Watch them in the wild, in the ocean.
Do you go in a boat? Alex, do you watch whales from a boat?
Yes, sometimes.
Do you ever go kayaking?
No, I don't.
Do you know how to swim?
Yes, I do.
Do you swim a lot?
No, I don't.
What types of exercise do you do?
I do walking and gardening.
What do you grow in your garden?
I grow tomatoes, peppers, and herbs.
Do you like onions?
Yes, I do.
What's your favorite time of the year?
My favorite time of the year is summer.
What do you like best about summer?
I like that it's warm and sunny, and I can spend more time with my wife in the garden.
So, Alex, are you having pain anywhere else?
No, just in my chest.
Do you have pain in your arms?
No,
Alex, are you allergic to any medications?
no, I'm not.
Are you allergic to anything in the environment?
No, I'm not.
When was the last time you had something to eat?
I had breakfast this morning.
What did you eat for breakfast?
I had toast with butter and jelly.
What kind of jelly do you like?
I like grape jelly.
Do you know how to make biscuits?
Yes, I do.
So I just turned his speech off, but that is a great example of how you can speak to Alex just like you would a person, and he will come up with answers. So that is the benefit of that generative AI. And none of that was scripted. In fact, I'll show you in just a moment. But I hope you can see from that demonstration how quickly and easily you can strike up a conversation. This is beneficial for your end users because the students and care providers need to learn effective communication with their patients. Um, are there any questions about the communication feature before I move on to some of the other points?
Nothing new right now, Shay.
Okay, great. So either I'm really good or you guys are super smart and you get it. I vote that you're super smart and you get it. So again, utilizing the smart stethoscope, there are different fields that you can place and compare breath sounds. So your learners are going to be able to do a full breath sound assessment, and they will be able to hear both normal and abnormal breath sounds. So the instructors, pardon me, I was about to fall out of my chair. The instructors can program those different breath sounds in so they can actually use Alex as a teaching tool, not just an assessment or a simulation tool. The same thing is going to go for heart sounds. They'll be able to auscultate regular heart sounds, but then you can also hear some of the abnormal heart sounds like murmurs, gallops, those types of things. So, again, just reinforcing using Alex as a true teaching tool. Moving down the abdomen, you can see here you can listen to bowel sounds, both normal and abnormal. So again, highlighting the ability for your care providers to do a full assessment. And then they can obviously go through and take blood pressures. You can see the little blood pressure cuff on the arm. And again, assess all of those pulses, both in the neck, so by on both sides, they can check for carotid pulse, brachial pulse, radial pulse, and then also in the feet on the top of the foot. So a lot of your end users will ask about pulse points. And again, this is a huge selling feature. Okay, so that is how quick and easy it is to use Alex. He has a rechargeable, whoops, super sensitive, so it's not hard to get him to talk. Um, you can turn off there.
I'm sorry. I don't understand.
Neither, Alex. So he does have a rechargeable battery. You can use Alex either plugged in or on battery. If you're using him on battery, the battery lasts about 4.5, 5 hours. If you're doing heavy simulation, obviously, if you're taking breaks in between, it's not going to use the battery as much. So great battery life. And again, cleaning is simple. You can use just gentle soap and water. Again, like don't get him soaking wet, but if you get, little dirty spots where they have touched doing patient assessment, you can just easily wipe those off. Don't use anything like your Cavi wipes or heavy disinfecting wipes on him because it will kind of hurt his skin a little bit. But really gentle, easy to clean. All right. What I'm going to do now is I'm going to just share my screen. So, oh, do we have any additional questions so far while I'm sharing my screen and getting set up for, um,
Nope, nothing right now, Shay.
okay, bear with me. This is the less than glamorous part of our show today. I hope everyone can see my screen. This is what an instructor or whoever is running the scenario would see. Erin, can you confirm that that is actually showing for everyone?
Yep, we can see your screen.
Okay, perfect. Perfect. So making real-time changes, I can just click on each individual vital sign. So if I want to change the heart rate, it's really easy for me just to kind of bump this up, move that around, and then send it right to the mannequin. And then his heart rate will change. Plus, I get a little alert that says the heart rate changed. I can also change EKGs. So you may have end users that ask about classes like ACLS or PHTLS or AMLS. I lovingly refer to all of those as the alphabet soup classes. So, yes, your end users will be able to use Alex and create the scenarios required for those courses. Very easy. So those are the vital signs. If I want to add in other diagnostic things, I can add in the type of exam I want. We can administer treatment, so I can log that because he's having chest pain, if we discover through his EKG he's having an actual heart attack, I can call an alert for that and that will get logged. I can set the next steps if I want, so that's great. The little ear feature here is all of the sounds. So I don't know if you're able to hear that I just pushed the groan and Alex groaned. Sometimes Teams and Zooms will mute these sudden outburst noises that kind of makes it difficult or impossible for people to hear. So if you didn't hear it, I'm sorry.
Here it,
All
Shay.
the Okay. Oh, great. I was going to say all the more reason to have an on-site demo with Alex.
Still do
But
that
here
though.
we I mean, you still want to do that, but so if we're demoing it, just sometimes don't fret. It's not an Alex problem, it's a Teams or Zoom problem. But here we can change the breath sounds. There are just a few examples. And then right here, this is where we would start the recording. And so the cameras are in Alex's eye. And again, it shows the video from the perspective of the patient, which I love, instead of like the Sim Center cameras that are in the ceiling where you get that bird's eye view. I think it's helpful and it helps your end users have some empathy when you see what the patients see. And this also incorporates sound, so you'll be able to hear how the end users, the care providers, are talking to each other while they're around a patient. And that's sometimes telling too. So moving on down, we've got the sim log. This is great for your end users, so you might want to highlight this. The instructors will care about this. So everything that happens when you assess Alex, treat Alex in any way, every action is logged electronically. And so this way, if a student says, oh, well, I know I checked those pulses, the instructor can go back to the log and actually see where it says listen to the heart sound, or check to pulse. The instructor can say, look, it wasn't logged, so Alex tracks everything we do. And that's helpful to the instructors, because then it's not a she said, he said situation. So the assessment tool is really helpful. And then finally, here is the checklist that the instructors can share with the students. So it's a go, no go kind of a situation. So they get a green check mark if they did something. They get that red X if they didn't do something. And then, as we saw in the example, it will eventually tally a score for you at the end of the simulation. Okay? So here are some, we've talked about the patient file. You can add in patient information, and here's how easy it is to edit. Alex likes to hike and ski. We'll put snow ski. He uses a Peloton. So here are his chief complaints: chest pain, difficulty breathing, and numbness in his right arm. And then all of that, will go directly to Alex. But this is so much easier than it has been in the past. So again, we don't want, and you can fill in all of this information depending on how detailed you want the questioning to go. So if we want, social history, if we want to make Alex a smoker, but this is also going to include, so if we're talking real life healthcare, when we're talking to patients, we ask them, do you take illicit or street drugs? And then sometimes we'll name them off, like, have you used heroin? Do you smoke pot? Because you have to use the language that your patients are used to speaking, not necessarily the most correct or prim and proper terminology, because again, we have to talk to our patients in the way that they understand. But this will give you a way to add in that information. We can add in surgical history, like Alex has had a hip replacement or he's never had surgery before. Things like, oh, he had his gallbladder removed, his appendix removed, those types of things. So any aspect of history taking, you'll be able to add this information in so that they can ask Alex questions about that. The other feature that is really great is that there is also a, see how it says you can turn the talk on and off? So if a student or end user asks a question that's maybe not the most standard question, and Alex may say something like, I'm not sure how to answer your question, you can type in, like I just typed in, I take vitamins, and then push that out and Alex will say that information. So, there's a backup in case the generative AI hasn't learned a proper response for that question. You can still keep the simulation on track. I hope that makes sense for everyone.
We have a couple questions, okay? So one of them
Sure.
is there an area to add information about depression or anxiety?
Yes, that will go back under, oop, so we can add it. Let me scroll down. So that's also part of, um, there are several places you can put it. You can either put it in chief complaint, history of the present illness. So if that's why Alex is, in to see the doctor, or you can add this as part of the family history because most care providers now do screen for mental health issues. So there will be questions like, Alex, have you ever suffered from clinical depression? Do you have suicidal ideations? Have you ever thought about harming yourself? Um, do you have ADHD? So you can write all of those responses or that history in there so the care provider can question. But then again, the backup to this is if Alex doesn't answer appropriately, you can also, you can type that in and Alex, can say it. So I hope that answers that question. So you can make it as significant or clinically unimpressive as you need to.
Thanks, Shay. The other question was, is there a feminine voice for Alex? And,
Yes. hmm So again, the benefit of this AI, there are several different root patients to choose from. So there are some pre-built scenarios that again you can edit. So there is an Alexandria in there. There are, several different feminine voices. There are several different deeper voices also. So it's not always just the warm and fuzzy regular old Alex version voice that you're used to, like with the old version. So, or the previous version, I should say.
thanks,
So,
Shay.
yes, you will have all kinds of options for that. All right. Aaron, I don't know how we're doing on time for demo, but this is really how quickly and easily you can use Alex. And again, if you want your particular sales director to either come see you and bring in Alex, or if you want a private virtual demo, we are all of us, whether it's the Southeast, North Central, Northeast, or out west, we are all happy to chip in, lend a hand, give you this kind of one-on-one instruction to help you help your customers. So, um, there are no stupid questions when it comes to stuff like this. So if your end users have a question, call us, email us. I tell people in the Southeast, you can even text me and I will answer, to the best of my ability. And if I don't know, I will certainly find out. So we are all here to help because our goal is to help you sell more Alexes. So let us know how we can offer additional, further, more detailed assistance for you.
I do have an update on the question about language availability. So
Awesome.
the previous generation of Alex will not have all the Gen AI language options. So if you need more than the options that exist with that one, it's a great time to have a conversation about upgrading. And there's a lot of pros, as you can see from, Shay's quick demo today of reasons of why you would want to go ahead and update to the Gen AI. There's also a question here. If we need a demo in Spanish, can that be accommodated?
Yes. So we do have bilingual folks within our company that can assist with that. So I will say, I'll just speak for me in the Southeast, and we are happy to accommodate just about any needs that your end user may have, to the best of our capabilities. The only thing we ask is that maybe you give us a little bit of lead time to help get the right people on the call. For example, we have someone in our company that speaks many, many, many languages. Um, but that might be subject to his availability as well. So just ping your individual sales director and let us know. And we'll talk to you about how to go about getting that set up. But yes, that we can accommodate that for sure.
We're doing great for time, but I'll just
Okay.
ask again if anyone has any, final burning questions that they want to ask Shay while we have her here.
If you leave this demo and you start thinking of questions, you can shoot them to your appropriate sales director by email. Um, just because we leave this demo today doesn't mean that we're lost and gone forever. We will always answer your questions about Alex or any of other of our products for that matter, but certainly about Alex since that's what we're talking about today. But we are, all of us, all of the sales directors, we're a great resource for you in terms of product knowledge. So when your end users do have specific questions, particularly about the medical capabilities, and let's say you're looking on our website and it doesn't necessarily spell something out, please just ring us up and we'll get you the answers um, that you need.
I think that might be it from a questions perspective.
Okay, I'm going to stop my screen share just right now because I forgot that was on. But if there are any other NASCO folks on the call that have anything to add, or you see something, or you think of something I missed, please do not hesitate to jump in and raise that issue now. So, oh, this is a great little comparison chart. Thanks for sharing that. And again, we'll get the slides pushed out to you, so you'll have them for reference. The warranty, that last line there, that's a great thing to take note of. So, there is a difference there, and the difference being you get full 5 years with the Alex Pro. And again, if you look at the Iris Cam, you are limited in the Alex Gen AI and the Plus models. But again, that Pro level has unlimited recording. Um, Also, the amount of questions that you can ask, the Pro is unlimited. So the students and end users can ask as many questions as they need to. If you'll pay attention though, the Alex Gen AI up to 250 questions per day, that may be okay for some end users, but if it's I'll just use a community college as an example, and they teach multiple classes throughout the day with, 30 students, they may need to upgrade to their thinking to the plus or the pro so that they don't run out of questions to ask per day. I know some of my basic EMT students, it took them 1,000 questions just to figure out sometimes how to introduce themselves to a patient when they're first starting out. So I'm a big proponent of always trying to suggestive sell the pro, but I understand that may not be in everyone's budget. But I think this chart is very important to share so that your end users can make an informed purchasing decision.
Shay, we do have one more question. I think that this just
Sure.
asking if the simulation log archive can be downloaded.
It is my understanding that it can, and you can export that and share that. So, talking about whether your end users are using learning management systems like Canvas or Moodle or Blackboard, some of those things that they'll be able to share that feedback with their students as a PDF or an Excel file, I believe. And Michelle with PCS is always welcome to correct me if that is not a true statement. So we can confirm with her to make sure, but um, I've not had the occasion to do it myself, but I believe that is a feature. All right. I think we are quickly approaching the end of our time together. So if there are no other questions, I'm going to turn this back over to Erin. She is our Vice President of Marketing, and she can close us out.
Awesome. Thanks, Shay. So first of all, thank you so much for doing this demo
Of
today
course.
for our distributors. I think this was hugely helpful in terms of understanding the differences between the previous Alex and the new, truly revolutionary Alex Gen AI. We're so excited that so many of you could join us today. We did record this webinar, so we'll be happy to share this after. And as Shay mentioned, we're also happy to share the PowerPoint presentation. We've also created some additional high-res images and assets that we're loading on our partner portal, and we'll be happy to share those with you as well to help in terms of your marketing and promotion of Alex. And please don't hesitate, as always, to reach out if there's anything that we can do to help you with that. So thank you so much for joining us. We really appreciate your time.
Say